Hi everyone. Today is the 11th of January 2018 in New Zealand. And yesterday I talked about debunking the myth that the best place to give birth was in your own home. And today I'm going to debunk the myth that the best place to give birth is in hospital. And it's really important that we debunk myths. Remember when we were younger, we were always told, if you tell the truth, it's a lot simpler than if you tell a lie. Because when you tell a lie, you have to develop all sorts of tiny little stories around that lie. And from my experience being involved in birth from the early 1970s to the present, it's not that people have really lied about childbirth. It's that they didn't understand the fundamental truth. And I don't believe there's a blame for that. When I go back and I take a look at why I think we got to where we are, I believe that it all started with three phenomenal male obstetricians who really were doing their best to improve women's experiences as modern maternity care became more prevalent. I was not around prior to hospitals, but hospitals are a very new concept in our human history. I have a dear friend who is still alive who gave birth right after the Second World War in the UK. Previously, women had both given birth in the hospital and at home, but the UK policy after the Second World War was to encourage more women to give birth at home because the hospitals were filled with caring for soldiers who had been injured in the Second World War. They didn't have the room or the professionals, so they preferenced, rightly so, young men and women who had been injured during the Second World War. And birth is, by nature, going to result in a healthy mother and a healthy baby, and is by nature essentially safe, except when it isn't. So even up to when I was born at the end of the Second World War in the United States, hospitals were fairly new within a generation or two, and birth increasingly went into the hospital, and there were reasons for that. My grandmother died of pneumonia prior to penicillin. She was 39. Antibiotics and immunizations, regardless of what you think about them, have saved millions, billions of lives. Up into the use of both of those, we, all cultures, all humanity, would expect to lose women from infections after the birth, puerperal fever or sepsis, and children from all sorts of reasons up to the age of 5. Go into any old cemetery. Children, 25 to 30% of children around the world in all cultures died before the age of 5. The reason we have a population explosion is not because we're having more babies, but because our children are living longer due to immunizations and antibiotics. So hospitals, and if you go back and look at the history of hospitals, they weren't always good. People didn't understand about disease or washing your hands. So hospitals were often a place where you died. During the United States Civil War, it was barbers who did surgery. They didn't understand about diseases or tetanus or anything. So modern maternity care really began to occur in my generation after the Second World War. By the time I gave birth in 1970, medical maternity care was very sophisticated, although compared to what it is now, it seemed very primitive. People gave oxygen to newborn babies and blinded them. Right? I mean, there are all sorts of issues. Cesareans were classical up through your pube to your belly button. You were given general anesthetic. My mother's generation were all knocked out for the birth, even though they were conscious during the hard part, the labor. But in the 50s, in the 60s, when these three male obstetricians came on the scene, Grantley, Dick Reed, Lamaze, and Bradley, these were men who could see, excuse me, could see that maternity care was becoming more medicalized and hospitalized, and they had a concern about it, rightly so, because women, the hospital was a place where people went because they were ill or to have surgery, and birth is a normal life event, as so is pregnancy. So why was maternity care becoming so medicalized? And there are reasons for it, and the reasons for it is that people are very sensitive about birth. Why are they sensitive about birth? Because it's so infrequent. I mean, consider how people treat marriages. They don't treat marriages as infrequent, they treat weddings as infrequent. So people spend a huge amount of time with the cultural creation of the ceremony around the wedding. They do that around birth and pregnancy. People don't get pregnant that often, even people who have very large families. A person having 20 children is very rare. A person having 10 children is less rare. 10 children, 10 pregnancies is rare in that person's life. So pregnancy and childbirth culturally around the world has always had a lot of ceremony and focus on it. And in the modern world, it did as well. And that focus tended to become more of a medical focus, because people were always aware that there were risks around pregnancy and childbirth. So for instance, a woman can be Rh negative. It wasn't until I had children that they understood that women could have an injection that would stop their baby from having an Rh incompatible problem. Prior to that, if you were Rh negative and your child was Rh positive, that child was at risk of dying. We have to understand these things. We didn't become medical because the doctors were running around the streets trying to cut us open, as some people have implied. That we became medical because there were risks associated to pregnancy and childbirth. And because it's infrequent, we ritualize it. We put it into the ritual we know. So Lamaze, Grantley, Dick Reed, and Bradley were the first human beings that I know of who said, hey, there's a universal way that women can breathe and relax in order to have their babies. In my opinion, that was the first real goof up, which was to focus those skills on women who wanted less medical care, pain-free birth, because they had seen some women have pain-free births. I've been with a few women, and I'm not a midwife, I'm not a doula, I'm not a childbirth educator, but that doesn't stop anybody from being at a birth. So I've been at hundreds and hundreds and hundreds and hundreds of births for 45 years, and I have seen a smidgen, handful of women literally have no pain during their labor. I've seen another percent, about 10%, really find it manageable, and another 10% find it manageable. And then the rest from 20 to 100% go from Jesus to, oh my God, I'm going to die. So labor pains by nature are not pain-free. But Grantley, Dick Reed, Lamaze, and Bradley felt that if women use skills, it wouldn't be that they had pain-free births, that they could manage their responses to pain. And they are right. So when we are skilled, we manage our responses. We cope, we manage, we deal with, we handle, we work through, we stay on top of, and we stay in control. Those are different ways we can explain that. So we don't say we have a pain-free birth. What we say is we've managed it. And that's what Birthing Better is about. That's why families develop the skills, is that we could manage how we responded to our internal sensations and the external factors. But we did it for all births. So when Grantley, Dick Reed, Lamaze, and Bradley said in the 50s and the 60s, pregnant women should become skilled for birth so they could demedicalize their birth, have this thing called a natural birth, and have pain-free birth, that was where the first goof up appeared. Because if they had had the foresight to say giving birth is always an activity for everybody, even if you're driving to hospital, being prepped, and having a surgery. This is an activity you have to do over time, and this is your baby's birth. So if everybody had said, birth is an activity, across the board, no matter what it's like, women can always use a skill to handle, manage, stay on top of, and in control, we would not be in the conversation we have now, because we would have a history through the generations of every pregnant woman who is infrequently getting pregnant, infrequently going to have a birth, to put into this cultural ceremony around pregnancy and birth, having skills, becoming skilled. And when fathers were then permitted to come in, and then others, everybody would become skilled in order to help that woman manage, cope, stay on top of, deal with, work through, and stay in control, no matter how that activity unfolded. So as we debunk the myth about having births in hospital, whereas we debunked the myth of having births at home yesterday, hospitals became a place of safety for people, not because women see pregnancy or birth necessarily as an illness, although many, many, many women bring disorders, diseases, whatever into pregnancy, and many women develop them in pregnancy, and they can develop in birth, either for the baby or for the mother. So the hospital became a place of safety, and partly it became a place of safety once people understood about germs, and once people understood about cleanliness. And so this ritual around pregnancy and birth was that you wanted to safeguard your mothers and your babies. Why do people give immunizations or have them? Why do people take antibiotics? Because there's a ritual around childhood illnesses and diseases that people want to stop from doing what they normally do, which is killing you, right? People don't want to die. They don't want their children to die. So they will do everything in their power to be risk averse. And if somebody raises their hand and says, I can stop sepsis or postpartum infection, everybody who has the ability to will go and get that help. So hospitals became a place that felt to modern women after the Second World War as though they were cleaner and they were safer. And so people went to the hospitals. And what did the medical profession do? They were trying to reduce or prevent the problems that did occur in pregnancy and birth. Why did we develop shots for people who are Rh negative? Because we want to prevent that problem. Why did people learn to give infusions, blood infusions or transfusions? Because they wanted to stop women from bleeding to death at birth. Why did they change the way they did cesareans from a classical cesarean that was done when I gave birth to the low-lying ones? Because they knew that when they cut the uterus up and down, that those muscle fibers didn't heal as well as if they just slit the muscle. And besides which, women didn't want to have a scar on their belly, so they were trying. In New Zealand now, where our trust is, they no longer use forceps really, because obstetricians aren't trained to use them, and because the natural birth movement said forceps damage babies. They do. But what did they have before that? What happens when you have tight crotches? Instead of thinking, oh, maybe that woman can prepare her crotch successfully to let a baby out, they cut the tight crotches and they went into the tight vaginas because they didn't know the skills to prepare the vaginas. This is what we're trying to change. So everything that is done in modern medicine is done to try to reduce or prevent the problems that can occur, and then they become standardized. And I was shaved. I was given an enema. This was standardized. Why was I given an enema? Why was I shaved? Because in the previous generation, women died of sepsis after childbirth from not being clean. So as they learned, they then tried to clean women up. Can't blame them. We all evolve. So when Grantley Dick Reed, Lamaze, and the Bradley method said skills were for this group of women, within 20 years, not enough women who put themselves in that group succeeded in having less medical care, natural births, and pain-free labors. But if we had started this whole conversation way back then with a group of skills that everybody had said, everybody, every pregnant woman, no matter what their birth is going to be like, should become skilled. Every person who is with her should become skilled to help her to stay and manage and control herself from internal sensations as well as the external stuff that is done to her or around her. We would not be in this conversation. So Birthing Better families knew that back in the early 70s when these skills were developed. We knew as families, one, we needed to become skilled, and two, we in fact needed to base those skills on preparing our pregnant body to give birth, because we had a big object that had to come out, and we needed to find ways to identify in our own body whether our body was tight or flexible. That's why the internal work really teaches you how to do successful preparation for the last 8 weeks to really soften and stretch all the internal soft tissue of all of your birth canal. And that just changes everything, because instead of this tissue stretching to a big object, it opens up, honestly, like a lotus. It just opens up. But it's not perineal massage, which only deals with this very small part of the tissue between the vagina and the rectum. We have tissue all the way up in there. But I'm getting off the point. Go back to the hospitals. We all went into the hospitals. We all had these things done. Lamaze in the United States was taught everywhere. So even people having the standards of care, the evidence-based practice of the day, we did try to use Lamaze skills or Bradley skills. Grantley Dick Reed was here in New Zealand. So, and what happened? We found that we dealt better even when we had all this stuff done to us. But the skills were still the first evolutionary step to developing a really true skilled population. Lamaze breathing was crazy. You couldn't do it. Bradley method of in the nose and out the mouth sounded from relaxed to screaming, so that wasn't realistic. We couldn't relax on the outside because it was the inside of our body that we had to really soften. So when Birthing Better families began to develop this with me in the early 1970s, we did develop skills to work through every birth. Women having cesareans, as long as they were conscious, wanted to do something. They didn't want to be passive. They didn't want to sit there like a lump on the table. Their husbands or partners wanted to help them stay engaged and be engaged and not be bewildered. So we developed skills for all births, all births, all births, all births without exception. And then we learned to prepare the body, because many of what was becoming obvious was that the reasons there was an increase in cesareans was that first stage, dilation, second stage, the pushing stage was being delayed. And it was being delayed because women have internal tension. They don't know they have it. So we had to create skills to recognize the 4 types of tension and to know what to do with it in each of our bodies. And we had to prepare down there, and we had to learn the skills to cope and to manage. So Birthing Better wants to change the conversation in childbirth. We want to get rid of the myths because there are too many of them. It doesn't matter whether you birth in the hospital, it's up to you. If you want to birth in the hospital because you feel it's safer, go for it. If you're going to birth in the hospital because you feel you have no choices, go for it. What we say as Birthing Better is that have skills. That's the simple truth. Have skills that work for you. Are there interventions at home births? Of course there are. Are there interventions at hospital? There are standards of care. There are less now than there used to be. Are there women birthing in drought and war? Yes, there are. Should all of them become skilled so that you can birth better, even if you're in a challenging environment? Of course, we should want that for all of us. Can we make birth better when things are fiddled at us? Absolutely we can. My last child was born in 1982. He was 8 weeks premature. I ended up in a strange hospital. They wanted to fiddle with me. I used the skills and they stood there and watched me birth my son myself. You have to behave as though you're skilled. And when you behave skillfully, then the medical profession relaxes, even if you have high numbers of risks. Because if there are no indicators that those risks are becoming problems and you're behaving in a dignified, skilled, obviously focused manner, everybody around you will relax and they will help you achieve the best birth for yourself, and you will work in an okay manner with the things that they feel they need to do to assess or to monitor, or procedures to safeguard you and your baby, and you will realize you're working together. So I've gone past my 20 minutes. Is there a myth about birthing in the hospital? Look, go to your Center of Disease Control, get statistics about life and death. And the reality is that giving birth, dying at a birth, or a baby dying at a birth is very uncommon. But people have ritualized it for a good reason, because it's infrequent. So people are going to where they feel it's the safest. What we're saying is Birthing Better is that you also have something to do with creating safety. Become skilled. Prepare your body to let out this big object, whether you're going to have a cesarean or not, because your body is still preparing to labor and have a vaginal birth, and learn the skills so that you can work through your baby's birth journey. This is your baby. It's infrequent. How valuable is it to you? Little? Big. It's big. So become skilled so that you can work through this birth journey with the dignity of being a skilled mother and a skilled father or other. So see you again tomorrow. Bye-bye.